Okay, everybody. Well, welcome to the Healthy Joints, Healthy Lifestyle Show. And today I have the amazing Dr. Isabelle Amigues. We actually had an interview a few months ago, and it was fantastic. And actually, Dr. Isabelle, one of my patients listened to it and she was like, who is that amazing French doctor? And I was like, that amazing French doctor is another rheumatologist who is so well educated. She went to Columbia, she's based in Denver. She was faculty in National Jewish for a few years, and she has a direct and concierge rheumatology practice in Colorado called Unabridged MBD. So welcome back to the show. I am so happy to have you. We had so much fun last time.
Yeah, I always love, I love being here. Thank you so much for having me again.
So you want to kind of, reacquaint our audience about your practice, because I know that things may have changed a little bit since we chatted last. Tell us
No,
more.
it just keeps getting better and better. So I opened the first direct care practice in Colorado, which means that I contract directly with my patients, which allows me to see my patients for like a much longer duration for the visits, as well as I give them my cell phone. I give them, they have access to me like all of the time. And because of this, I am able to put my patient, I mean, it's not me, it's my patients are able to reach remission faster than I've ever seen. And it's kind of this, oh goodness, I just love this practice. It's just, I love my patients. It's just this idea that like, how could I offer the best of me to my patients? And it feels that I am able to offer the best of me. So I'm loving it. So yeah, that's my practice.
I think that's what my patients actually sense, and that's kind of how I think we both feel about our patients. I love the time with our patients. I know we have that in common, and I really admire you, right? I admire the fact that you have the direct patient care, which kind of removes you from the insurance mumbo jumbo and really allows us to kind of do what we came to medicine to do. So I really admire that about you. And thank you for kind of forging ahead, kind of with kind of the future of
Yeah.
medicine. So love
Yeah.
and admire you and respect you as my dear friend for kind of forging ahead. So today, really, a lot of patients have been asking about rheumatoid arthritis. And I thought, let's talk about that a little bit, right? So one
Yeah.
of the top questions I get all the time when a patient comes in and is kind of diagnosed newly with rheumatoid arthritis is, what is rheumatoid arthritis and how does it differ from all the other forms?
Oh, oh yeah, the network had was
Oh, the
shaking.
network, did you lose me? Should I
No,
repeat myself?
I'm back. No, I'm back. Okay, so rheumatoid arthritis is an autoimmune disorder, which means it's basically your own immune system is, I don't like the word attack, but basically it causes inflammation. So you have a part of you that's recognized at something that should not be there. So, right, so we make cancer cells, we have infection, you eat, there is some infection, some bacteria that may, cross the gut. And so constantly our immune system gets rid of those cancer cell or of those bacteria, right? Like we are this equilibrium, this balance. And in autoimmune disorder, the issue is that we are out of balance and the immune system recognizes a part of us as not supposed to be there. So then it causes inflammation because that's the way of getting rid of what's not supposed to be there by the immune system. And so then you develop joint pain because it's causing inflammation of the joints. You can develop erosion. And what's really interesting, and I would say that out of all the topics that are in rheumatology, I'm more specialized in rheumatoid arthritis because of all the research that I've done in rheumatoid arthritis. But so in rheumatoid arthritis, you also have inflammation of the heart, inflammation of the vessel. You can have inflammation of the skin. You can have inflammation of your lungs. So it's really what we call a systemic disease, even though, so systemic as the just everything, really, that's what it means. Like everything can be affected, but it
Yeah.
usually touches the joint first. So that is what is rheumatoid arthritis.
Yeah. So I love the way you explain that. And I think it really helps us to kind of understand that, the immune system is there to kind of protect us. And that is protecting us, like you said, from cancer cells. It's protecting us from, gut infections, right? Which is a whole big topic on its own too. But thank you. I love that explanation. Okay, and then so other things that then they want to know, how does it differ from the other kinds? So that's part two of the question. How does it differ from the other kinds? So you kind of said a little bit about, okay, how does it happen? At least the theory behind it. And then how do you because the patient comes in and is like, okay, great, but how does one differentiate it from the other kinds of arthritis, for instance?
That's probably one of my favorite questions, actually. And I was just talking to one patient today. So I was explaining that when you have joint pain, the way we differentiate those type of joint pain is we basically look at, is this inflammatory or is this mechanical? The mechanical is usually a joint pain that's worse at the end of the day, that improves with rest and does not have what we call morning stiffness when you have to do this with your joint.
Yeah.
Or it's less than 30 minutes, we say.
Yeah.
An inflammatory arthritis is worse in the morning.
Yeah.
It's worse when you're at rest. It's associated with morning stiffness of more than 30 minutes. And so I remember one of my friends was like, I keep having to move my back, and she had, an inflammatory back pain.
That's right. Wow.
Yeah, that is inflammatory, right? Worse in the morning, associated with morning stiffness of more than 30 minutes. And if you have swelling of the joint and it, looks inflamed, that is probably inflammatory arthritis. So that is how it differentiates. Like, I think that those, like, once you make that difference, like, it's already huge because you can really say, I'm dealing with an inflammatory arthritis.
Yeah.
And then consequently, once you have a rheumatoid, like an inflammatory arthritis, looking at how they present. So rheumatoid arthritis presents, it's symmetric. It usually affects the joint of the hands, loves the wrist. So love the side of the wrist because the it's a tendon loves this. And love the MCP and PIP. And usually, like, no, actually, always, it does not touch the DIPs.
Yeah.
It's symmetric. It also loves the feet, so the ball of the feet. And that's like the most common. Of course, you can have back pain everywhere. Normally, there's no back pain when there is rheumatoid arthritis, so you should not have back pain. You should not have involvement of those joints.
That outer knuckle. Yeah.
Right? Unless you have also osteoarthritis, because right, you can have both. You can have osteoarthritis, mechanical joint pain there, and then you can have MCP, PIP. So this is where the art of being a rheumatologist comes in, because that's really what we're trained for. Like, is this RA? Is this RA plus OA? Is this psoriatic arthritis? Is this gout? But usually what we say about rheumatoid arthritis is that it's a constant pain with just moments that are worse. Like, that's different than gout. Gout, there are moments where there's no pain. And it's inflammatory, it's symmetric, and it usually touches the hands, the wrist, and the feet. Like, it loves that.
Yeah, and that's fantastic. I like your description of it. One of the ways, that I sometimes I explain to my patients is I think of rheumatoid arthritis like a bully. And so he loves all those small joints that you just point to, right? Or he likes those small joints because the bully, it tends not to affect like the back and spine, just exactly what you said. Thank you for that clear explanation. So I think we've talked about, I think the other question that we get, we've talked about symptoms a little bit. So maybe I will go to the other question that the patient had, which was more about lifestyle. And I know you are the guru. So what do you tell your patients about lifestyle changes or maybe even self-care measures that they can help manage their RA?
Well, so the first thing first. I do think that we are very lucky to be in 2024 with incredible options. And if I had to choose one rheumatologic disorder to have, I would choose rheumatoid arthritis out of every single other joint, right? Like, osteoarthritis is not inflamed, but there's no treatment for it. So it can be really annoying. I don't want to have gout because it's very painful.
Yes.
It's the most painful one. And so, and rheumatoid arthritis, we have so many options in terms of treatment. And so
Yeah.
that's number one. Now, you know, I'm actually quite aggressive in terms of treatment because we know that to treat someone, to get them to remission, is basically allowing them to have a longer and a deeper remission. So the faster you get patients to remission, the better. And also the better in the sense of like it's going to probably last longer, maybe forever. And then the
Yeah.
second is that you're not going to have any of the complication related to rheumatoid arthritis.
Yeah.
And that's the idea of a fire. When you have a fire, you don't take a pipette or just a little glass of water and put some water there. No, because this is important because some people sometimes are like, oh, you're holistic, so you're not going to offer me medication. And I'm like, no, my goal is to get you into remission and then we can back off. And there are some
Yeah.
studies that are showing that they are able to back off from TNF inhibitor in studies like
Yeah.
I think it's controlled trial, but where you can
Yes.
stop, and some people didn't need any medication for 3 years. So yes,
Yes.
are not cured, because cured would be that you never need
Need
anything.
anything anymore. Yeah.
But you're in remission without treatment for a long time, which is phenomenal. So that's the first piece of information, because I think it's so important, and it's so important to realize that our goal in RA is full remission. And
Yeah.
remission is different than cure. So I'm not selling snake oil here. I'm literally telling what it is that we learn and that we teach in medical school and rheumatology fellowship, which is like the goal of RA treatment is full remission. And we call it remission or minimal disease activity. That's what we call the treat to target.
Yeah.
Okay. So now, once we do this, like, right, when the patient is fully in on this, there are ways that you can actually help also with lifestyle. And the reason I take this as a second is that this is a complement. And like,
Yes.
if you have a ton of fire, yeah, absolutely, medication, right? But once
Yes.
the fire is gone, like
Yes.
someone that needs to be out, like who is contemplating stopping his medication, that is
Yeah.
when we're going to be like, okay, let's look at your lifestyle because we want you to
Yes.
be successful. And so there are a ton of studies that are showing that meditation,
Yes.
visualization, breathing work,
Yes.
stimulating the parasympathetic system. I'm going to tell you about this after. All of this actually decreases the inflammation in rheumatoid arthritis patients.
Yes.
And so to me, it's always fascinating, right? If you do meditation, your cytokine profile decreases. Like it's
Decreases. Yeah.
like the inflammatory
Exactly.
cytokine profile decreases if you have
Yeah.
RA, and they did a controlled study on that. So that's really cool. It
Yeah.
changes your genomic as well, which I think is super cool. And there's like two types of things that you can do. And I think you should just do both, right? The
Yes.
meditation, which I think everyone should do.
Should be doing that anyway.
Yeah,
Yes.
exactly. Yeah. And you can be like, if you're someone that prays, prayer is a form of meditation. So that's totally fine too, right? So meditation. And then the second is the visualization. You can visualize yourself very healthy, no pain,
Yes.
happy, and feel that.
Yes.
Or like both of them at the same time. Not the same time, but you can choose one day or the other. You can also visualize a healing, sort of energy going to your joint and so on. And there are some studies showing that if you do that, you actually have less pain and you have less depression as well. So less pain, less depression for patients with rheumatoid arthritis. So, I mean, how cool is that, right? Like it's all in
That
the
is
mind.
so cool.
Yeah.
But let me ask a question actually. So, for someone like me who I guess I would like to know a little bit more about, where do you learn about visualization, right? What does visualization really mean? What does that mean? I can imagine that, but I don't know that that's what we're talking about. So tell me how does one even learn to become a visualization person kind of thing?
Yeah, that's a really cool, that's a very cool. So usually in the meditation, when you can put meditation, visualization, like honestly, you can put visualization, meditation, scanning, body scanning, and that
Yeah.
way you can go on YouTube and you'll find a body scanning in apps.
Okay.
Calm app. I love Headspace because they have this very sexy English accent. So very, very cool.
So Headspace is an app that
Yeah,
is,
it's an
or is
app.
on, yeah, is an app that you can. I remember Calm because I used to play that night to sleep.
Yeah, exactly. And they have all sorts of meditation. And so I think the really cool thing about meditation is to realize that they're all very different and they are all
Yeah.
hit differently. And it
Yes.
might also change with life, right? So I used
Yes.
to do a body scanning. I used to do this. I loved it. I haven't done it for a long time now, but I
Yeah.
used to meditate for 5 minutes. And then
Yes.
I was kind of like trying to just get all my mind back to the breathing. And of course,
Yes.
it goes everywhere, right? So that's when I probably realized I'm probably a little bit ADHD, but that's okay, right? So I would just be there. And then I would start
Aren't we all?
yeah, right. I would start scanning my body, and I would start with my feet. Thank you, feet, for like making me walk. Thank you, ankle, for being so strong. Thank you, knees, for carrying me and helping me hike. Thank you, hips. And then I would go, so I'm a physician, right? So I would go very deeply sometimes. I would go into the anatomy and physiology of different stuff. And then, the ding of it's the end
Thank you,
would
left
come up.
kidney. Thank you,
Yeah,
right
exactly.
kidney. Yeah.
I was like the glomeruli and thank you the
Yes.
GFR.
Okay. Oh, well, you meant business.
I,
Yeah.
I, yeah.
Thank you.
And I think, but the cool thing is that it doesn't matter, right? Like at the time when I did this, it's like I needed that somehow.
Yeah.
My body
Yeah.
needed that, or my mind needed that, and that's where we went, and I went with it. And
Yeah.
and what I love is to send some love the same way that when we look at our kids when they are sleeping after they've been really tired,
Yes.
and a kid that's
Yes.
asleep is always
Yeah.
adorable, right? Like you're like, oh. So that's
Yes. Always.
and I send that feeling into all of those joints and
Yeah.
all of those organs, and it feels really good. And so, there's a
Yeah.
study, they are doing a study. So this is actually kind of cool. You can stimulate what we call
Yeah.
the parasympathetic system. So you can stimulate the vagus nerve.
Yes.
And
Yeah.
they do that with stimulation for epilepsy.
Yeah.
So seizures
Yes.
and all this. And they do that for a couple of other
Yeah.
diseases. Epilepsy, I find very cool.
Yeah.
It means that
Yeah.
the parasympathetic
Yeah.
system does play a role.
Yeah.
Anyway, so they are doing a study right now. They're enrolling patients to stimulate the
Yes.
parasympathetic system
Yeah.
by stimulating the vagal nerve.
Yes.
So I tell my patient, I'm like, do you want
Yes.
the stimulator, or do you want to do the exercise that can stimulate the same way?
Yes.
Because at the
Yes.
end of the
Yeah,
day,
actually, one of my patients is doing that.
this,
Yeah, one of my
okay.
patients actually doing that same study, yeah, with the stimulation of the vagus nerve, and she honestly is doing better.
Yeah.
She is doing better. So
We
yeah, which
think,
is kind of what
yeah.
meditation is kind of doing for you.
Yes, exactly. So you were asking me all of the things, right? So what stimulates the parasympathetic system, which is this vagal nerve?
Yes.
Meditation, visualization,
Yes.
being
Yeah.
surrounded by loving people,
Yeah.
humming or singing, because it vibrates your vocal cord, vibrates and stimulates the vagal nerve. So if you just become
Yeah.
suddenly a singer in the shower, go for it. Like have your kids
Yeah.
sing. That's really good. Go to a
Yeah.
choir.
Yeah.
And then
Yeah.
the one that's more painful is going into a cold shower or a cold bath. This is very hard for me, but I try to do it.
Yeah.
And so those are
Yeah.
things that you can do, and it's super
Yeah.
good. And
Yeah.
you don't
Yeah.
even need a stimulator. So I'm
Yeah.
intrigued. I looked at the study, and they are not doing a third arm, which would have been so cool if they had done a third arm to see if
Yeah.
doing the visualization meditation would have worked. But
Yeah. Was
there are
getting, yeah, was
companies,
getting,
there
yeah.
are
Yeah.
companies that wants money from their device. They are not going to do
Of
that.
course, yeah, they're not interested in saying that, wow, if you meditate to get the same results, that would be
Exactly,
So
right?
actually, so for our guest listeners that really don't understand the whole vagus and parasympathetic, would you be
Yeah,
able to kind of explain a little bit? Because I
certainly,
think we're taking it for
certainly.
granted that they understand parasympathetic versus sympathetic.
I
Yeah,
think
let's
it's,
kind of, yeah.
maybe it's because of Colorado. Everyone knows that in Colorado. So I'm like, okay.
Okay.
I used to explain, and then I was like, okay, fine, I'm explaining something that everyone knows. But yeah, the adrenergic system. So we are so well done, right? We have this
Yes.
balance between adrenergic system, which is the fight
Yes.
or flight. So
Yes.
you see a bear, you're gonna think, do I fight or can I fly? Can I fly
And I
away?
run.
Yeah, exactly. And so what do you need in those cases? You need to have your eyes open. You need to have a very good sense of smell. You need to have a ton of oxygen inside your lungs. You need to start putting blood in your muscle. Your heart rate start pumping. And you're going to stop all the things that are not useful if you're in a fight.
Necessary.
And
Yeah.
so you're going to stop the digestion. You're going to
Yeah.
stop you're going to stop healing because that is not
Yes.
where your energy
That's
is.
not helpful.
Exactly. And so then what's happening is that you're in full fight mode of like, I'm gonna fight or I'm gonna fly away.
Yeah.
And the issue is that nowadays that is kind of almost a constant state. That is because of
Yeah.
work, because of the stress. Like our life is
Yeah.
just so fast.
Yeah.
Our life is going really, really fast. And so we're constant, like, and if you're listening to the news, forget it. Like you're
Oh,
always
oh my God. Oh my gosh. Oh my gosh.
PSA, stop
We're
listening to
all
the
gonna
news.
die. We're all gonna die.
Yeah, I know. Pretty painful. And then you're like, oh, I don't
It's
even know what can I
crazy.
do? What can I do? What can I do? Right.
Yeah.
So all this so that is probably the state that we're the most in, which
Yeah.
why you and I just said earlier, everyone
Yeah.
should meditate,
Yes.
because
Yeah.
really, like everyone should start having some time done to just like restore, like sleep well
Yeah.
and meditate. So
Yeah.
that really
Yeah.
changes your life. So the
Yeah.
parasympathetic system is literally the opposite system of the adrenergic.
Yeah.
So you're either in this adrenergic stimulation or you're in
Hyper.
parasympathetic stimulation. And what does it does? It increases the blood flow to your gut so that you digest well. It increases the immune system to heal.
Yes.
It
Yeah.
it helps basically your heart rate slows down, your blood pressure
Yes.
slows down. And like even just
Yeah.
talking about it, I'm like, yeah, basically you're feeling good.
Yes, you are. I'm feeling, I feel like my heart rate's going down. Things are coming down. Stop sweating, you know.
That's funny. I kid you not. I have a patient the other day. I was putting the blood pressure cuff on her. I'm doing my own
Yeah.
vitals because I
Yeah.
actually enjoy doing that. So I'm doing my own vitals, right? And so on my patient, and she's like, hold on. And so she starts like breathing super. So I think her blood pressure was a little bit high because we were talking.
Yeah.
Like, no, no,
Yeah.
no, repeat it, hold on. And she starts like breathing and meditating.
Oh.
I kid you not, her blood pressure normalized completely. And I was like,
It's
oh,
like,
this is so good.
good for her, though. Good for her for having the awareness,
Yeah,
right?
she was so
And
cool.
knowing
She's
that,
like,
okay,
yeah, I know how to
yeah,
do this. I do it all of the time. Everyone knows it.
yeah, good for
Like,
her.
oh,
Good, she has her little vagus nerve stimulation just on
yeah,
her own, just kind of calming herself down, getting
yeah,
her vagus
yeah.
nerve to just kind of slow down the heart rate and slow down all that adrenaline stuff that we get exposed to in this crazy world that we're all, running helter skelter.
Yeah, yeah, it's cool. So
Yeah.
yeah, I
Oh,
think that is what the parasympathetic system does for you.
yeah.
It's literally just
Yeah.
think of the best sleep ever. You stimulate your parasympathetic system when you're asleep. And
Mhm.
so yeah, good sleep, breathing work, just like relaxed. And so that is definitely helping to heal. There's no question. Yeah.
Yeah. And so we just talked a little bit. Thank you for it. So thank you for that. I think that's, I think I totally agree with that. And, I think you kind of summarize that idea is sympathetic system is you're running from the bear or the lion, right? Parasympathetic, you're having nice, peaceful sleep. Your heart rate's down. You're not having any nightmares. Everything is calm. You're getting your foot massage, that kind of thing. So I think that's kind of the difference. But I think, yeah, I really love the way you explained it. But you touched a little bit about something. You mentioned that the clinical trials that's going on. And I think with kind of the vagus nerve where they're basically trying to artificially create that system. Do you have any thoughts generally about, because I think patients are sometimes reluctant to get into clinical trials. And do you have any thoughts about the benefits of clinical trials in general? not necessarily even that one. Do you have any
Yes,
thoughts about?
that's really interesting. Number one, because I might go myself as a patient into a clinical trial that's a little gutsy. And there is that thought of, oh, I'm gonna go into a clinical trial. Should I? Should I not? I'm not sure. So, and it's the physician brain that reassures me. It's not the patient's brain
Yes.
that's reassuring, it's the
Yeah.
physician brain that reassures me. So that's a really good question. I think that there's two answer, like in general, what's really, really important is to realize that, like, especially when you're coming from an insurance-based system, meaning that I'm seeing
Yes.
patients as often as I need to and as they need
Yes.
to. And I have, if I need to see a patient tomorrow, I will see them tomorrow. If I need to see them on the
Yeah.
weekend, I'll talk to them on the weekend. So for me,
Yeah.
it's a little bit different. But in the vast majority of practices right now,
Yeah.
you cannot see your doctor like that easily. You're going to see them every
Yeah.
month at best. Sometimes
Yeah.
you may be able to see maybe an advanced practitioner, but they don't know you as well as the doc, right? When
Yes.
you're in a clinical trial, you're going to get
Yes.
the best follow-up after direct care, right? And so I think that that's really, really important. The second thing is it's going to be free medications for you. So
Yes.
if you don't have insurance, or if you have an insurance that doesn't necessarily pay very well, that is
Yeah.
actually super good. The third is that you may look at the study and then you may be like, you know what? I really want to try the stimulation of the vagus nerve. I don't want to be on a medication, and I would much rather stimulate my vagus nerve. Like that's also very cool, right? So I think,
Yes.
you look at what's offered and then you're like, okay, you know what? This medication works. And I will tell
Yes.
you, my kids were very, very preemie. They came
Yeah.
at 6 months, and they're
Yeah.
twins. And they had, the only complication they got was what we call retinopathy. And basically, I'm explain why I'm talking about that. So basically,
Yes.
like overgrowth of all the vessel, as if you have diabetes, and
Yes.
it can,
Yeah.
because it puts all of those vessels everywhere, what happens is that
Yes.
you can actually lose your eyesight, right? And the
Yes.
treatment at the time, it was 2015, the treatment at the time was laser ablation. And so
Okay.
you go on the retina
Mhm.
and you go everything.
Get rid of the
And
vessels. Yeah.
yeah, and the dad, my dad, their dad is a
Yeah.
physician, extremely smart, like the smartest physician I've ever met. And
Yeah.
I'd read, so my way of coping with having twins that were that preemie was to
Yes.
sing them, lullabies, and like talk to them, and
Yeah.
they were like preemie. His way of
Yeah.
coping was to read everything up
Wow.
to date, and I think he became a NICU specialist, right?
Wow. Yes. Yeah.
Very funny. He knew everything, but he had read some studies about the retinopathy, and so basically,
Yes.
he had read some studies showing that they were getting patients, including preemie, into trials to see if putting Avastin, which is the treatment for diabetic patients with
Yes.
retinopathy, would
Yeah.
work. And
Whoa. Wow.
we talked to the ophthalmologist, and they agreed
Yes.
to do it.
Wow.
And the next year, it became standard of care for all of the kids. And
Wow.
what's really, really cool is to realize that we didn't actually go into a trial because we were like, we want this, right?
This.
Uh,
Yes.
but the really, really cool thing there is to realize that sometimes something makes sense to you. Sometimes it makes
Yes.
sense to the physician. And so
Yes.
as a way to say, you know what, I think right now, look at the amount of inflammation you have. This is way
Yes.
above. Maybe you have failed, like TNF inhibitor didn't work for you. When
Yes.
you try this
The
other one.
standard haven't worked.
Yeah, your
Mhm.
insurance won't agree with this one, but there is now
Yes.
a new anti-IL-6 that's coming on the market.
Exactly.
So then it allows us to get what you need faster,
Yes.
like faster. So
Yeah. Yeah.
I'm all for trials. I think it's really important to be
Yeah.
part of it. Like, it can actually really enhance your care in certain
Yes.
situations. Not all the time, because we have so good treatments anyway. So, but yeah, I
Yeah.
hope it's a
Yeah.
little long,
Yeah.
but
I know that
no.
was, totally, totally agree. And, and so, people get into trial for different reasons. Sometimes people their grandmother had rheumatoid arthritis kind of thing. So in addition,
Oh,
or they're worried about their kids and they want to make sure, because the amazing medications that we have for rheumatoid arthritis is because somebody
yeah.
actually got into clinical trials, right?
Yeah.
That we have all these amazing options. But wow, this was a wonderful time, Doc. I really appreciate you coming on. So tell me, how can people find you? People want to work with you. I'm sure some of my patients are going to say, I saw her again. Tell me how can I find her? So how
Yeah.
do we find you?
Well, the first thing is I'm going to say is that I just created a Rheumatology 101 YouTube channel where I'm live
Love it.
on Tuesday. So for me, it's 11. So that means what, your 1 hour, it's 8 p.m. right now. What are you, 7?
Yeah,
So
it is 7 p.m. Yes.
okay, so it will be at 10 a.m. for your people. So if you just look at
Okay.
Rheumatology 101, uh,
101.
you
Yes.
can have access, you can look online. So you can look at Unabridged MD, you can look at
Yes.
Unabridged MD. I have the
Okay.
Instagram and all of the social media
Okay.
on Unabridged MD, but
Okay.
really it's cool. I just did 2 lives about rheumatoid arthritis. Our third one next week is going to be how do we treat rheumatoid arthritis? It's usually 10
Perfect.
minutes, 10 to 15 minutes of presentation, and then after that,
Yes.
I'm leaving time for questions.
Question
And
and answers. I love it. Yeah.
so I just
Well,
started.
thank you for, yeah.
Yeah.
Yeah, well, thank you for the service. So what I'm going to do is I'm going to post at the end of this. We're actually going to post kind of the links to your social media and
Yeah.
also to Rheumatology 101. So, well,
Okay.
thank you, Dr. Amigues. I appreciate you coming. Hey, everybody, appreciate you watching. If you think this video is helpful, like it, share it, subscribe to our channel, A Healthy Joints, Healthy Life. Have a wonderful day, everybody.